Okay, it's almost 3 o'clock, so let us get started. I will share my screen. Let me know when you can see the screen. I am showing a presentation now. Let me know when you guys can see the presentation. Can you see the presentation? One of you can maybe unmute and tell me yes or no.
No, sir.
My screen is still not visible.
Sir, it's visible.
It's visible. Okay. Okay, great. So, first of all, let me welcome all of you to this session. Uh, Let me talk about I2CAN and myself first. Indian Institute of Cosmetology, Aesthetics and Nutrition is the name of organization that I am representing. My name is Nandan and I am the Managing Director of I2CAN. We prefer to call it I2CAN, it's short form for Indian Institute of Cosmetology, Aesthetics and Nutrition. Uh, we conduct training courses for doctors in the field of aesthetics. So that is what we do, and we have been doing this for almost 6 years now. This session, we keep organizing these sessions at a periodic interval, and the intention of organizing these sessions is to provide you guys with an overview of what is medical aesthetics, what is, or aesthetic medicine as some people call it, what all things are included in this, what are some of the machines or procedures that you can perform in aesthetics, and how can you go about introducing this in your current practice. That is the intention of this session today. We have around 2 hours for that, and I have 80 slides. So everyone, please keep yourself on mute. I can do that, but for that I'll have to switch screen every time. And if somebody is unmuted, then the background noise disturbs everybody. Thank you. So as I was saying, I think I will have to do that. Yes, and now we are okay. So as I was saying, we have 2 hours and I have 80 slides to cover. So it's better that we get started quickly. Let's first define what is this field and what is included and what is not included. So we will look at the definition, a standard definition as per the books. It says that it's an emerging branch of medicine that relies on procedures and techniques to improve and enhance the appearance, texture and contours of the skin, face and body. So this definition itself tells you few things. First is, what is it not? It is not dermatology. What is dermatology? It is disease treatment. And aesthetics is not dermatology. Aesthetics deals with what? Enhancement of one's appearance. All the procedures which will help you to enhance your appearance or your patient's appearance. Now, if you look at aesthetic medicine as such, it is even more specific. Aesthetic medicine involves all the procedures which are not invasive in nature. The invasive procedures, all the set of invasive procedures have a separate name, which is called aesthetic surgery. So aesthetic surgery is not something that we are going to discuss here. We are only going to discuss aesthetic medicine, which is going to include things like your topical and oral medication. It is going to include all the non-invasive procedures, and it is going to include all the minimally invasive procedures. So that's what this whole field comprises of. Now, why this field is becoming more and more popular? Let's look at some of the facts before we'll understand that. If you see, the life expectancy worldwide is increasing, and it is increasing because of the advances in the medical science, which means people are living longer, and if people are living longer, for a longer period of time they would want to look good, and all the signs of aging start appearing after 35 plus, and by the time you cross your 50 or 55 years of age, these are extremely prominent. So if you are living say up to 65 years, then it's only 10 years that you have to really take care of yourself, against if you are living for 80 years, then it's a 25-year span when you have to take care of yourself. If you really see the ratios and how the ratios are changing, in 2000 it was almost like a cone. So the age group up to 40s was quite straight, but after that there was huge amount of tapering, which means very few people lived beyond that. And if you look at 2050, what is predicted, you see this is almost straight all the way up to 60 years. So almost everyone will live up to 60 years of age, and then it starts to taper. So which means people will live longer, and hence they will need these treatments, and they will need it for a much longer period of time. Now, how is this industry doing in India? This is just a glance of how it is doing in India. It's a huge industry. It's almost 1 lakh crore industry annually. If you look at the turnover, it is employing 20 to 30 lakh people right now, and it is the 4th fastest growing industry in the world. It's a big industry, and it is growing at a very fast pace. Why is it growing at such a fast pace? Some of the reasons you can see here in the bullet points. India is a growing economy, and that means there are more and more people which are getting added to that middle class every year, where they have enough money left after taking care of all their basic expenses. And when you have money left, that is the money that you spend on these kind of things. Secondly, the social norms are changing. Say you go 20 years back, and once you were like 45, 50-year-old, looking good was never on your priority list. But that's not the case anymore. Society has changed, evolved, and looking good is something that is important to people till they die. So looking good is no longer optional, it's even important from your career standpoint now these days. So for the senior positions like CEOs, etc., one of the criteria is that you should be presentable. And being presentable at that age when you will become a CEO, of course, involves some sort of taking care of your skin and hair. So those are some of the reasons why this industry is growing so fast. Let's now look at what are some of the most popular treatments. So this slide gives you a lot of matrix, it gives you a lot of information. First picture, if you look at this picture, it gives you the top 5 treatments. Now if you see, the top 5 treatments are all non-invasive. There is no surgical procedure in top 5. And that is because people always prefer non-surgical treatments if that option is available. If you give somebody an option between a surgical procedure and a non-surgical procedure, they will always end up picking the non-surgical one, because there is lesser risk, there is lesser amount of money to be spent, there is lesser downtime, and because of all those reasons, they always prefer the non-surgical option. So the first one is of course Botox. Second is all the laser based treatments, in particular laser hair removal. That is the second most popular treatment. Third is microdermabrasion. Fourth is fillers. So we always talk about Botox and fillers together, but they are different, separate. So fillers is the third most popular treatment. Fourth is chemical peels is the fourth one, and then there are like other popular treatments. Now age wise, if you really look at this particular distribution, almost half of your patients will be somewhere between 35 to 50, and then 1/4 of them will be less than 35, 1/4 of them will be more than 50. Which are these patients who are less than 35? They are not coming for aging concerns, they are coming for other skin conditions, so hyperpigmentation, acne, those kind of things. And which are the patients who are more than 50 and they are coming to you mostly for aging? Now that percentage, as we saw, that people are going to live longer and there will be more older people added to the society. So this percentage is going to go up in future. Let's look at male versus female distribution. It's a female dominated industry. Almost 90% of your patients will be women, only 10% will be men. So 1 out of 10 will be men, 9 out of 10 will be women. But you look at these percentages 5 years back and men were like less than 5%. Today they are almost 10%, which means the growth of male patients is much more than the growth of female patients. And maybe 20-25 years from now, we would reach a situation where you will have 50-50 ratio. So don't ignore your male patients because they are going to grow at a much faster pace than your female patients. And where are these treatments happening? Almost half of them are happening in individual clinics. So where there is no surgical facility, where there is no facility to admit you, these are called office procedures where you come, get the treatment done and leave. And you are never in these centers for more than say 1.5 hour duration. So almost half of them are happening in those kind of facilities. 1/4 of them are happening in big hospitals and the remaining 1/4 are happening in centers which are having surgical facilities available. So that's the distribution of it. Now when you talk about aesthetics, I always say that it is very different from all other healthcare institutions or practices. Your normal clinical practice is very different and your aesthetics is very different. Why is that the case? Let's see why aesthetics is different from your normal clinical practice. If somebody wants me to define it in one word, I usually go and tell them that in clinical practice you have patients and in your aesthetics you have customers. And these words more or less sound like the same things, but they are not. The moment somebody turns from a patient into a customer, the expectations will change drastically. And the easiest way to actually see that is if you go to a big hospital, go to a very big hospital in your city, spend half an hour there, and then go to say a Kaya or a VLCC and spend half an hour there. Look at the difference in the experience that you get from both the places. Now your normal patients do not have any specific or special expectations from the clinic or from the doctor. Even if their appointment is not timed, they are more than willing to wait. They don't have any specific requirements about how the ambience should look like, what facilities should they have, etc. But your customers will have very specific expectations. One is they want their appointments to be on time. So if you have given somebody a 3:30, it can become 3:40, but it cannot become 4:30. The customer is going to be extremely unhappy and you will lose him or her. Second is they have some expectations from how the place should look like. It should be aesthetic, it should be clean, it should be well lit, it should be it should have all the basic facilities like air conditioning and all of that. They will expect that. They should have a nice place to sit if they have to wait. They will not stand and wait. So that's the other thing. And the last one is they will have more privacy needs. These are not the procedures that you go out and discuss. You don't want to discuss these things. So privacy is a bigger concern for them as against say a normal clinical practice where patients don't mind letting somebody know that I have cough and cold. But then if I'm doing anti-aging treatment, usually I don't want people to know that I'm doing that. So that's how this industry is different. Now let's look at how this industry is changing, some of the trends very quickly. I don't want to spend too much time on this. I want to go to the real stuff as quickly as possible, but it's good to understand the context, and then when we discuss the technical stuff, it will start to make more sense. Now if you look at aesthetics, one trend is that it's moving from luxury segment into a need segment. This is precisely what happened to say salons or parlors. If you go 35 years back, then these salons were luxury. So you average middle class person man or woman, they never used to visit parlors on a regular basis. Today it has become a necessity. So whether you belong to middle class, even lower middle class, upper middle class, it doesn't matter. Parlor is a must. Similarly, right now the change or switch is happening for the aesthetics industry also, that people have started realizing that this is not luxury. After a certain period of after a certain age, we have to go and undergo these treatments if we want to continue to look good. The second trend, if you see, is this is moving from reactive to preventive. And what do I mean by that? In fact, the entire healthcare industry is doing that. By reactive to preventive, what I mean is instead of waiting for some symptom to occur and then treating it, you tell them that you have to do these maintenance things so that you never have a problem in the first place. So whenever you start your own aesthetic clinic, you will always have to have some rejuvenation kind of offerings, where people who come for treatments, you can treat them, they will get well, and then you put them on the maintenance stuff so that they never have that problem again. So because prevention is always better than cure. So that's one of the trends. All the biggies like Batras or Kayas or VLCCs of the world are more going into this prevention mode rather than the correction mode. Selling an experience rather than a service, that's another trend, that combination treatments is the way to go. In fact, now you have custom products also. So there are now possibility of you seeing a skin specialist checks your skin, and then he custom makes the products and gives it to you. Even that's a possibility now. So people are selling an experience for every individual. They check, and then based on the specific conditions, patient's medical history, etc., a very unique set or combination of treatments is devised for that particular patient. So these are some of the trends. Of course, the most interesting marketing platforms for aesthetics continue to be Facebook and Instagram, because everybody who wants to look good is on these two platforms. And if you advertise on these platforms, you are expected to reach the right target audience. Quickly look at how COVID has impacted the industry. Now, of course, we'll go through the bullet points, but just to tell you how quickly this industry is recovering from COVID. I don't know if how many of you know, but there is a company called Allergan which owns Botox as a brand. So Botox is owned by Allergan. I was talking to the Western sales regional head of Allergan couple of weeks back, and he was telling me that their December 2020 target was same as their December 2019 target, which means the industry has bounced back so quickly. They are already selling what they were selling last year before COVID. So there is a very quick bounce back in this industry. Now after COVID, what will happen? Few of the things which will continue to happen is, one is online consultation and counseling will slowly pick up. It will continue to pick up even after COVID is gone, because people will realize that traveling and spending so much time in traffic and then waiting and all of that does not make sense if they can get almost the same quality of counseling from online consultations. So that is one trend which will remain. Second is people will become paranoid about hygiene. So because you belong to aesthetics industry, it was always important. Hygiene was always important, but now it will become even more important. So if your clinics are not hygienic, and if you are in aesthetics industry, you will start losing customers very, very quickly. Economic depression will continue for next couple of years. So not couple of years, for next couple of quarters, I would say. So by end of 2021, we will recover completely, but this year the prices will have to be tweaked a bit. We'll have to be a bit more understanding about how much can be charged, because everybody is going through a tough time. So those are some of the impact of COVID on this industry. Now, if you want to start your own center, here are some guidelines for you. it's not something which needs huge amount of space or huge amount of investment. That's one good part of aesthetics. So most of the times, if you are practicing and if you have your own center, you can, if you have your own clinic, you can start aesthetics from your own clinic. There is absolutely no problem. If you have 2 rooms, waiting area and your doctor's chamber, you can start with that. Although what we recommend ideally is that you should have 3 rooms. You should have a consultation room, you should have a waiting area, and you should have a treatment room. Why treatment room and consultation room should be separate? Because a lot of times these treatments may take a while, so maybe 45 minutes to 1 hour. And if you have consultation patients, then they will have to unnecessarily wait for that long. So that is why it is better, but you can always start with 2 rooms. The amount of investment needed is also not very high. If you take out laser machines from the equation, then the entire setup machine cost will be like less than 1.5 lakhs. That's how less it the investment is. And if you already have a clinic, then the rest is already there. In terms of interiors, we again recommend you don't overspend, don't try to make it too jazzy. It should be well lit, it should have a common theme, so you should not like have waiting area is red, your consultation room is violet, and your treatment area is blue. It should, the entire center should have a common theme. Light colors usually go well, but other than that, you should not overspend on interiors either. And then basic facilities, air conditioning is a basic facility now these days, and then some people prefer to have a television so that people who are waiting have something else to do. Earlier people used to have a Wi-Fi, which is not needed anymore these days because everybody's phone data is good enough these days. So those are some of the guidelines. The bottom line is it's not a big deal. It's not like you are spending lakhs and lakhs on that. You can very quickly get started. Now, one other question which always comes to me, so what is included in aesthetics and what is not included? So I'll just try to give you a very quick overview of that, and then we'll proceed to the other parts of the presentation. So what procedures are allowed for these doctors? Now, you will hear different terms. You will hear about a dermatologist, you will hear about a clinical aesthetician, and you will hear about a cosmetic surgeon. What are they allowed to do? If you look here, down here, then this actually shows you what are they allowed to do. So their dermatologists typically are skin specialists. So all the disease treatment work is theirs. So everything that you see here in dark blue, disease treatment, you should not get into that. You should not even try to get into that. That's not your domain. Cosmetic surgeons are primarily into all the invasive procedures where all layers of skin are penetrated. So all the invasive or surgical procedures is their domain completely. Now, okay. Now, so there are no questions so far. We'll go back to the ethical considerations. Now, medical practice is all about ethics. Similarly, in aesthetics also, we of course have some ethical considerations here. Disease, what is a disease? The definition of a disease is becoming fuzzy these days. Now, aging, is it a disease? Or acne, is it a disease? That whole definition itself, because what we are saying is skin disease treatment is dermat's work, and then appearance enhancement belongs to aestheticians. But these days that whole definition becomes a bit fuzzy in certain cases. So you will really have to take a call based on case to case basis and see if it is in the best interest of your patient that you get into this intervention. Now, if you really see some of the moral dilemma that you will come across is a patient walks into your clinic and says, I want to do Botox. Should you go ahead and do Botox? Now you should do it if you feel that it will improve his skin condition or it will help him to look better. You should not do it if you do not feel that way. If you feel that by doing Botox it's not going to help him, then it is much better to discuss it with that person and to convince that person to go for the right kind of treatments or no treatments at all. Now there are some patients who have some psychological conditions like BDD, for example, body dysmorphic dysfunction, where people don't like their body, and whatever is there, they don't like it, they want to change it all the time. If you feel that a patient with that kind of psychological problems has walked into your clinic, then morally it is wrong to treat that patient. You should rather consult and help him in the right way, or you should refuse to treat that patient. Because we always have to remember that aesthetics, like all other medical practices, is a profession. It's not a business. So the moment we start doing it as a business, that becomes a problem somewhere. So what should, there are three examples here, and who should you treat, who should you not treat. If there is a facial reconstruction of an accident victim, of course you should go ahead and do it. It's a there is a valid reason for doing it. Addiction to aesthetic procedures, people who have done like 30, 40, 50 modifications to their faces in past 5 years, 6 years, I don't think it's right to treat these kind of people. We should refuse that treatment. And somebody who walks in and talks about, I want to look like that celebrity, you will have these kind of patients also. It is better to talk to them and explain them that that's not how it works. One thing you should always ensure is that your patients have a realistic expectation of the outcome, because if that is not the case, they will always be dissatisfied. Now these are like some of the points. I'll not go through all of them because we have a lot to cover, but if you want to build and keep your patients' trust, then these are some of the things that you should be doing. You should look at their wants and then really see if these things can be done. Is it even possible to do that? Do a very good and realistic consultation to your patients. Tell them what the risks are. Be very clear about the risks. And then despite the risk, if the patient agrees to do the procedure, then only go ahead and do the procedures. Give him a very fair idea of what is it going to cost. Sometimes intentionally or unintentionally, we don't give the whole picture to the patient. So somebody saying, okay, peeling, it will cost you 2,500 rupees per session, but we don't tell them that they will have to undergo 10 sessions. Now 2,500 kind of sticks to the patient's mind, and then when he has to come back 10 times, he realizes that amount is actually 25,000. So giving him a very fair idea of what is his total spend going to be is also something that we should always be doing. Now let's understand beauty, because this whole domain is all about enhancing one's appearance. So without understanding beauty, we cannot do that. What does beauty do to an individual? What are some of the advantages of being beautiful? If you really look in a social environment, being beautiful or being good looking always helps you. If you really see, good looking people have a much better chance of cracking, say, a job interview. So two people with same capability, one good looking and one not so good looking, if they appear for an interview, the one with better looks always gets selected. Better looking people are also more likely to get promoted. It has even been observed that if somebody is better looking, good looking, then even if they say lose a case, a court case, the sentence is much milder for them. So if say somebody breaks a red signal and there is a fine and the whole thing goes to the court, then the actual fine, the amount of fine is much lower for this person. They will always have much better response from strangers. So if a person goes to ask for some sort of help from a stranger. If the person is good looking, it's much more likely. And these are not like things I'm saying. All these studies have been conducted, anonymous studies have been conducted on thousands and thousands of people. And these are the actual outcomes of those studies, that these things do happen. These are real. So, and that is why looking good is extremely important from social standpoint as well as from your career standpoint these days. Now, one of the early notions of beauty was that there is no definition of beauty. It depends on which era you are in. In 16th century, the definition of beauty was very different. Today, the definition of beauty is very, very different. Second thing is, it is also highly dependent on your overall culture. So definition of beauty in India will be very different. Definition of beauty in the US is very different. That was the original notion. And then there was a lot of research conducted on that, and people came to the conclusion that some parts of beauty are universal. No matter which era you are in, no matter which culture you are in, some traits of beauty are universal. They appeal to everybody. And this has been concluded based on a lot of research work. So that is the latest modern theory. Now these traits are called canons. So there are some canons which are universal. That is what people have concluded. And there is an entire branch of science which is dedicated to studying proportions and ratios of human body, which is called anthropometry. We cover that in our courses. So there is a separate session only on anthropometry where we try to understand different ratios which make sense, which make somebody beautiful, and proportions and all of that. Now, just to prove the point, to conclude, there was a research conducted on babies. Now, if you look at a baby doesn't belong to an era. Baby doesn't belong to a culture. A baby has no influence of all of that. It was observed that babies look at certain faces for a longer period of time. So if like 100, 200, 500 people come in front of the baby, then babies are more likely to look at certain type of people or people with certain faces for longer periods of time, and they smile more, which means there is something that strikes a chord. And these are our basic instincts. Babies do not have any cultural influence or any other influence whatsoever. So those are basic human instincts which are at work, and those instincts is what continue to work throughout our lives with us. Now there are two primary theories behind attractiveness. One theory behind attractiveness is evolutionary mate selection theory, which means thousands of years back, when we were still living in jungles, selecting a mate was very important, because your basic instinct of survival is reproduction, and for that you would want a healthy mate. And there were some features on your face which reflected health, good health, and those traits always appeal to us because we still have those raw instincts in us, and those traits still appeal to us. And that is what makes somebody, when somebody with those facial traits come in front of us, then that we feel that person is very attractive. Second is the sense of averageness. Now being average is not good. It's not considered to be good. People say you should not be average, you should always be above average or good. But in terms of beauty, average is good. So for example, if you take 100 people, measure their noses, length of their nose, and take the average, you will get a number. Now everybody whose nose is closer to that number will always appear to be more attractive to us. This is again based on studies. So in that sense, being average is good. So people with average facial features always look good to us. Second is symmetry. So people with symmetrical faces always appear more beautiful than people who do not have symmetrical faces. Crooked nose is a very good example. Crooked nose is not similar. Similarly, there are some people whose eyes are not both eyes are not same, they look different, and those people do not look attractive to us. So those are, some of the things in terms of beauty. Why should we study as aestheticians? Why should we understand what is the right definition of beauty? Because we may have patients who would come with a very specific ask. I want to do a nose job, or for example, a very specific ask. We should be able to see how the patient will look like after that particular job is done, and whether it will actually make him more attractive or not. And if we want to have a good understanding of that, we first need to understand what proportions look good and what proportions don't look good on face. Second is, if we are doing a procedure, then how should the procedure be carried out? We will be able to decide that in a much better way if we have a fair idea of how we want that particular part of the face to change. And for that, you need to again have a good understanding of these ratios and proportions. So that brings us to the end of our second section. We'll now look at skin in a bit more detail, and we'll do that not from just a standard standpoint. We will do that from the standpoint of aesthetics, because I'm not actually going to explain you the intergeometry system. I'm going to talk about skin from the standpoint of aesthetics. Let's see. I see there might be some questions. No. Okay. Are there any questions at this point of time? Okay, so if there are no questions, we'll proceed. So this is skin, of course, is the largest and heaviest organ in our body. It provides us the protection that we need to all the other organs of the body. It's also the most visible part of our entire body, and it consists of three layers primarily. It has epidermis, which is the topmost layer, then it has dermis, and it has hypodermis. Let's now go ahead and look at what does skin do. First of all, so functions of skin. The first and most important part of function of skin is protection. It protects us. And what does it protect us from? It protects us from all the external invasions. So it protects us from the external factors like pollution and all the other environmental factors. It protects us from viruses and bacteria and all that germs, all of them from entering our body. It is responsible for secretions, so pushing the waste out of body. That is one of the functions of skin. But it's also responsible for absorption. So absorption, not just in terms of applying something topically and it goes in your body, but also in terms of say sunlight. The skin is responsible for absorbing sunlight and then using it for synthesis of vitamin D in our body. So it's responsible for absorption to a large extent. It's responsible for heat regulation, because we want our body temperature to be regulated no matter whether the outside environment is cold or hot, and skin does that. So there are sweat glands which are responsible for ensuring that the body temperature gets regulated. And of course it is responsible for aesthetics. This is how we look. When I look at somebody, I am actually looking at light getting reflected from the skin of that person. The skin of that person provides the first impression about that person to me. So aesthetically, it's the most important part of our entire body. Although looks is not everything, I agree to that, but first impressions are always created based on that. So that's why it's important. Now let's look at the continuum. So this portion, as I was saying, this is epidermis. This thickest portion is dermis, and then hypodermis is this yellow portion, which is below dermis. Now,
तसं नाही तर आता
as I was saying, epidermis is not just one layer; it's a stack of layers, and there can be like up to from 10 layers up to all the way up to 30 layers. Can everybody else go on mute, please?
जर तुला लगेच दवाखाना टाकायचा असेल तर नाहीतर टंगळ करायचं
Everybody else, can
मला
you guys mute yourself,
वाटतं
please, because I can hear people talking.
काय करायचं टाकून सोबत सोबत स्टडी करायची याची एक्झामची काय होत नाही पेशंट मध्ये नको
Okay, let's.
बोलो.
So let's get back here. So why is it important to know? Because what I'm telling you is that your skin is thinner on certain portions of your body and thicker on the other portions. Now when you do any treatment, you expect to penetrate in your skin up to a certain level. So in certain treatments you only want to penetrate up to epidermis, in certain other treatments you want to penetrate all the way up to dermis, and in certain other treatments you actually want to go all the way to hypodermis. Now, knowing which part of yours of the body you are treating, you know what the thickness of epidermis is going to be. So you should not accidentally go deeper than you want. So that is why you will have to keep in mind how much you have to penetrate and where are you, so how thick your epidermis is. So that is one of the things you should always keep in mind. Now, other than that, the most important part in epidermis is melanocytes and keratinocytes. Melanocytes will create these cells. Melanocytes are basically cells, and then keratinocytes melanocytes will create melanin, and keratinocytes are cells. So keratinocytes are, if you look at this picture, this is your stratum basale. This is where keratinocytes are multiplying, and once a new keratinocyte cell is born here, it starts to move up. As it moves up, it loses moisture, it becomes drier and drier, and it becomes deader and deader, and by the time it reaches your epidermis, it is completely dead. So the nucleus of that particular cell is gone, it has died, and it's a completely dead cell. It becomes flatter because it loses moisture, otherwise it's like a normal cell, but it becomes flatter and flatter. So as you can see, it's a stack of flat dead cells. These are called corneocytes. So keratinocytes will become corneocytes by the time they reach there, and after a while your skin will shed them, and the cycle continues. So this whole cycle takes around 20 days for keratinocyte to reach from here to stratum corneum and then get shed. So this, what we need to understand is this is 20 days in a young person. As you age, you start this cycle starts to increase. So instead of 20 days, this cycle will start to take maybe 25 days or 30 days. And what that does is it increases the thickness of stratum corneum, because these dead cells are there for a much longer period before the reinforcement comes. And as I said, these stratum corneum is drier because these keratinocytes are losing water when they go up. So here these cells have only 15% water, whereas when they are here they have 75% water. So if you have a thicker portion of drier skin, then that makes your skin dry. That is why your skin becomes drier when you age. With age, your skin always becomes dry. And then we'll talk about melanin. So melanocytes are also in stratum basale. So all of this thing is getting created in stratum basale, and then it is moving up from there up to stratum corneum. Now this is the typical structure of a melanocyte. If you see, is like a finger-like structure, and this generates melanin. So melanocytes have melanosomes in them, and these melanosomes are responsible to, these are the factories where melanin gets manufactured. And then this melanin gets into corneocyte cells, and with that it moves up. Now melanin is what gives our skin our color. If there is more melanin in the body, then we will have a darker skin. If we have less melanin in the body, we'll have lighter skin. Melanin is of two types again. You have eumelanin and then you have pheomelanin. Pheomelanin is pinkish red in color, and it is found more in people with lighter skin, so white people, typically Europeans. Whereas eumelanin is black and brown, and it is what makes skin darker. So when you are dark, you have more eumelanin and you have more melanin in general. So you have more melanin as compared to a lighter person. Now, why do you have more melanin? There is a reason behind that. Usually when there is more sunlight, people living in that region will be darker. And that is because sunlight carries ultraviolet radiation, and this ultraviolet radiation can be extremely harmful to skin cells. It can, if the ultraviolet radiation, so UVA and UVB, those are the two ranges, if it gets into the skin nuclei, then it can alter the DNA structure, and that cell can then become cancerous. So it can cause skin cancer, and melanin protects us against that. So that is why when we are in an environment where there is extended amount of sunlight, generally you get darker because your body starts producing more melanin. So this is something you should understand uh, about melanin. Now this is a map, and as I said, it's just interesting. You should see this, how it works out exactly. I said that people living in more sunlight are darker. So if you look at this graph here, the red region is where there is most amount of sunlight, and then as the skin gets lighter, you have less and less light. And now look at how the skin color changes. It's exactly the same. So the most amount of sunlight means darkest color, and then as the sunlight goes down, it becomes lighter and lighter. Now we go to dermis. Dermis is most, now about epidermis, you should always remember that most of the times, for most of the procedures you are doing around aesthetics, you will be penetrating only up to epidermis, only for hair removal and some of the other things, pigmented lesions, and in some cases tattoo removal, you will go to dermis, but it's limited. Even when you talk about chemical peels, your very superficial peels and superficial peels are only penetrating up to dermis. Your microdermabrasion is only working up to dermis. Most of your ablative lasers also remain only within epidermis. So most of the cases you restrict yourself only to epidermis. You are working there. Typically when you are talking about anti-aging kind of treatments, you are mostly in that. Only for very deep wrinkles and all of those things you would want to go deeper, but otherwise that is the region where you mostly work with your non-invasive and minimally invasive procedures. Now we come to dermis. Now dermis has a lot. It has very crowded place. It has a lot of things happening here. If you see, this is where you have blood cells. So you have no blood cells in your epidermis, and that is why sometimes you see that when you cut your skin, you feel that blood will come out. It doesn't, because you are only cutting up to epidermis. You're not going to dermis, and there are no blood veins or arteries in your epidermis. So you have blood veins. First of all, here you have hair follicle, you have different glands, muscles, and all of that. So it's a crowded place. There is a lot there to see and understand. But we will restrict our discussion to some of them. One important part in dermis is, of course, hair. It's an appendage, skin appendage, but it's a very important one, especially on your head. It really defines beauty in most of the cases. When you start losing hair on your head, you become very uncomfortable. So hair is a very important part, and how the process of why you start losing hair and all of that, that's something we cover in detail in our trichology module. I'm not going to discuss that here, but that's one important part. Second important part is glands in this portion of your skin. You primarily have two glands, sebaceous glands, which are attached to hair follicle, and they are responsible for secreting sebum. Sebum is what? It's a sticky stuff. So if you don't wash your hair for a long time, they become sticky. It's because of the excess sebum deposited on your hair. It is basically to keep them hydrated and well oiled, you can say. So sebaceous glands produce sebum. If for some reason this so the, these are the pores from where sebum comes out. If for some reason that pore gets clogged and sebum starts getting deposited under that clogged pore, you will have something called as acne. That is acne basically. And once this pore gets clogged, then all sorts of bacteria itself starts depositing here, and then it infects that particular region. Your white blood cells rush for rescuing, they die rescuing you, and that whole thing becomes pus. So that is what clogging of pores can result into because of excess sebum. And how much sebum you secrete will decide whether you have oily skin or you have dry skin or you have combination skin, and all of that. We'll look at that in a bit, but that is what decides all of that. And then you have sweat glands. So sweat glands, these white things you see here, these are sweat glands. Their primary purpose is heat regulation, temperature regulation of the skin. So when skin gets hot, then you secrete sweat, and then sweat gets evaporated, hence cooling the skin. So that is the function. Now in sweat glands, you have eccrine glands and apocrine glands. Eccrine glands are the ones which are responsible for formation of sweat. Apocrine glands become active primarily during puberty, so they have a different function. But eccrine glands is what is responsible for you sweating basically. Now in this region, in dermis, there are three things which are most important from aesthetic standpoint. You have GAGs, which is glycosaminoglycans. Glycosaminoglycans, which is called GAGs, and you might have heard about the term hyaluronic acid, or you might have heard about a term heparin. All of those are GAGs. Then elastin and collagen. This is what is generated by fibroblasts, which are in your dermis region. So fibroblasts are responsible for making GAGs, elastin and collagen in your body. Now collagen, elastin, all of those things is what ensures that your skin remains elastic. And when you lose elastin and collagen, your skin becomes loose. So that is why elastin and collagen are important. GAGs like hyaluronic acid are responsible to keep the skin hydrated. So as I said, in dermis region, your skin is almost 75% water. So that keeping it hydrated, well hydrated, is something that hyaluronic acid needs to do. And if the amount of hyaluronic acid goes down, then your skin will become dry and flaky. So let's look at these in a bit more detail. So GAGs, elastin and collagen, all of them put together, they form something called as extracellular matrix, which is, this is the most important structure within dermis. It provides stability to dermis, and it is mainly responsible for elasticity and suppleness of the skin. So and this ECM, the moment it starts becoming weaker and weaker, as you can see here with age, the moment you age, this ECM becomes weaker and weaker, and the skin starts to sag. And this is what is a typical wrinkle, you can say. Now collagen is responsible, as you can see here, and here you can see how the amount of collagen and elastin proportionally. So I'm just writing collagen here, but this is basically everything, collagen, elastin, everything put together. It goes down as you age. So collagen is responsible for structural strength. It is responsible for tensile mechanical property. So if you pull the skin and leave it, it moves back in its original position. That is the tensile property. Elastin is responsible to maintain elasticity of skin and flexibility of the skin. And GAGs like hyaluronic acid will provide viscosity and hydration to the skin. Now, you might have seen or heard about a lot of products having hyaluronic acid in it. Most of the fillers will have hyaluronic acid. So when you lose volume from your skin, so when your cheeks sag or your cheeks go, you know, become do not remain fuller anymore, then you can inject hyaluronic acid to ensure that that gap is filled and they look fuller again. And this hyaluronic acid that you inject is identical to what your skin is producing. But what happens over a period of time as you age is you start losing it and your body cannot remake it. So then you have to externally inject. That is some of those procedures of fillers primarily is what that is all about. Now, hypodermis is the last layer of the skin, and you don't go to hypodermis at all. When you are treating skin or hair, you don't go to hypodermis. When will you go to hypodermis? Hypodermis is nothing but your fats. So your skin fat pads and other parts of the body is this layer. So when you are doing weight loss or fat loss, that is when you reach this layer. So if you are doing slimming or weight management using machines, so you using things like lipo or you are doing Faraday or those kind of treatments, then you reach this layer. Otherwise, in your normal skin and hair treatments, you will never go to this particular layer. There are two more things which are important when we talk about skin. So epidermis and dermis, that is transepidermal water loss and pH. Now, transepidermal water loss is the water that you lose from the skin other than in the form of sweat. So sweat is intentional, but you also somehow lose some water, and one of the most important purposes of your skin is to stop this water loss, and there is still some water loss. This water loss is called transepidermal water loss. So generally 300 to 400 ml per day transepidermal water loss is normal. But if this increases, so if your barrier function of your skin gets compromised somehow, you will start losing more water, and then your skin gets dehydrated, it will become drier. So transepidermal water loss is something that you should keep track of. If it increases, so there are a lot of things which might compromise the protective barrier of your skin, and the moment it gets compromised, your TEWL will increase. Similarly, pH of skin. Now, pH of skin is important because the kind of products you use on the skin, you should see what the pH of those products is. It should be closer to what the pH of your skin is. Now, pH, pH values. pH value tells us whether something is acidic or basic or neutral. 7 is neutral, less than 7 is acidic, and more than 7 is basic. Now, we will tend to feel that our skin should be neutral. It is not. It is acidic. So pH of our skin is anywhere between 4.5 to 5.5, and that means it is acidic, and it's acidic for a reason. It is acidic because naturally all the viruses and bacteria will get deposited over the skin, but because of this acidic nature of the skin, they cannot survive there. So it's a protective mechanism that by making skin acidic, you are protecting your body from a lot of viruses and bacteria and whatnot. So if you apply products which are having very high pH, then they may damage this protective function, because your skin pH will increase, and if your skin pH increases, it is easier for that bacteria and viruses to survive on your skin. They get more time to try and infect. So products that you are using, always keep in mind that their pH should be somewhere around 4.5 to 5.5. They should not be too basic. There are a lot of products, and that is also why when you use detergent is very, very basic. So if you wash clothes or wash utensils, etc., then after that you feel your skin is very dry, because it has compromised that the protective function layer of your skin, and your transepidermal water loss means your skin becomes dry. So if you do extensively get in touch with detergents, this may happen. So you should always wear gloves if you are doing this for an extended period of time. So that is all about skin. I'll just take a minute to see if there is any question. Okay, I don't see that there is a question. Nobody has any questions at all? Are you sure? Can you hear me? Okay, can everyone hear me properly? Oh, great. Great. So we finished skin and its structure from aesthetic standpoint, of course, not from a very theoretical standpoint. Now let's see, why do we age? Because you will be either treating skin conditions, or you will be treating aging. Aging is going to be half the game, more than half the game actually. So it's very important to understand why do we age in the first place. Now, when we age, our entire body ages, and similarly, if you look at face, then you should not only focus on skin. That's one of the big problems that we do when we are treating aging skin, because we should not just look at skin. Most of these symptoms that we see, aging symptoms, they are because of changes in 4 different layers. Of course, the skin ages, but then there are soft tissues behind which are also aging. There are facial muscles which are also aging. These soft tissues are called fat pads. So they are aging. Facial muscles are aging, and our bone structure is also aging. So there are changes happening in all 4 of them. So when you are talking about a specific symptom of aging and you want to treat that, you should see what layer needs to be treated. So if you are treating, say, fullness, lack of fullness, because you have high cheeks when you are young, and then those become flatter and flatter as you age. Now that is because you are losing fullness there. Now if you want to treat that, you should focus on the fat pads, because they are the reason why you are losing that fullness. So if you have, say, light wrinkles, you can stay at skin level. You can treat them at the skin level. That is why when you talk about the eye region, then it may also be because of your bones, because the corrosion in your bone means that your eye sockets become bigger when you age. So all those, you will have to take all of those factors into consideration to decide which particular type of treatment is going to be best for that particular individual. Now, this is the same woman in her 20s, 30s, 40s, 50s, and 60s, slowly aging. And if you see what is happening there is, her skin is becoming more and more loose. So it's very tight here, and slowly it starts becoming more and more loose. There are fine lines which appear first. So this nasolabial fold, if you see, it increases. There are some fine lines on the head here, and then they become deeper and deeper at some point of time. So when fine lines appear, and then after that our face work, so you are smiling or you are angry or with different emotions, those lines become more prominent, and when the emotion goes away, the lines again become fine. But with age, that particular expression starts to stay. So because we lose flexibility and elasticity in the skin, so the wrinkles start to become deeper and deeper. You can see that her jawline is very, very well defined here, whereas as we move, the jawline becomes less defined. And you can, one more thing you can see, which is here, if you see, the cheekbones are very full, and then slowly they become flatter. This is volume loss. You will see that her chin is very well defined here, and slowly she starts accumulating more and more fat there, and then her chin becomes double chin. Now, chin is one portion of the entire face which accumulates fat as we age, whereas cheeks is one area which loses it. And we will see why that happens in a bit. And the entire face, you can see it drops slightly because of gravity. So because your skin is not elastic anymore, gravity starts to play its own effect, and the entire face kind of drops down. This is called the triangle of youth, which inverts with age. So you have an egg-shaped face, which is the upper portion of the face is bigger and this is slimmer. And with age, it becomes more round. So you lose this gradient that you had earlier in the face, you lose that. So when you are young, you have very well defined high cheekbones, you have full cheeks, you have defined jawline. And then when you age, your cheeks become flatter, you have a sagging jawline, so it's not well defined anymore, and you have fullness between the neck and the chin, and that's your double chin, you can say. So that's what happens. Now let's look at each individual part which is playing a role. Skin. Now in skin, your glands, both sebaceous glands as well as eccrine glands, will lose their ability to produce as much sebum or eccrine or sweat that it used to produce, and that means your skin will become, because you're producing less and less sebum, your skin will start becoming drier and drier. So age induced dryness is always there in skin. So even if somebody has oily skin, as that person ages, the skin will become less and less oily, and some of them may actually become dry after a while. You lose collagen and you lose elastin from both from and hyaluronic acid, GAGs, from your dermis, and that means your skin will lose its elasticity and its firmness. It will become loose and you will start having wrinkle formation. Now, once you have these wrinkle formations with repeated facial movements, these wrinkles will become deeper and deeper, and from being dynamic wrinkles, which is dynamic wrinkles appear when you are having a particular expression on your face and then they go away. These become more static, which means even when you are not having that expression on your face, those wrinkles will still be visible, and then the entire skin becomes saggy. The second part is the fat pads. It's also very important part, as you can see here, because with aging your skin is becoming loose. It's not able to hold the fat pads in its place, and what that does is the entire fat pads move down, so they slide down. So these fat pads from here, they become weaker, as you can see, left versus right, and they go and start getting deposited here. So they drop, and that is why now in the chin area you have double chin. These fat pads have accumulated there, and from here you have volume loss. Muscles also lose their strength, and because muscles lose strength, they cannot hold the fat pads will slip, and they also, because of a lesser strength of muscles, the elasticity of the skin also gets impacted. And the last thing is bones. So this region becomes bigger, and here there is corrosion in this area in the bone structure, and that is why it is not able to maintain a very well defined jawline anymore, and jawline becomes saggy in nature. So as you can see, there are all these components have their own impact, and that entire thing gives birth to all those symptoms of aging. So sagging skin, loss of volume, wrinkle formation, all of those things appear because of all these things combined. Now, impact of aging, very quickly, I don't want to spend too much time here, but of course your cell replacement and wound healing abilities go down. Cell replacement, I talked about keratinocyte cells. So it is, the entire replacement cycle is 20 days and it increases, which means your skin has a thicker portion of stratum corneum, gets drier, you'll have sensory functions working at suboptimal levels, DNA damage repair ability goes down, immune function goes down. That is why older people are more prone to catch skin diseases, because their barrier function has been compromised. So their entire epidermis is no longer what it used to be, and hence they are the bacteria, viruses are more likely to penetrate down. Similarly, the impact of UV light can also mean that people in higher ages are more likely to have skin cancer, because you don't have enough melanin being produced, and because melanin production has gone down, there is a more chance that your UV rays will damage some of the nuclei of some of the skin cells. Your vitamin D production goes down and your barrier function goes down. Now, aging is not just happening because you are becoming older. Aging can also be extrinsic. And when we talk about extrinsic aging, there can be one of these factors which are playing its roles. Photo damage, because of excessive exposure to sunlight, your skin can age prematurely. Environmental pollution, mental stress, medication, the kind of food you are eating, all of that will impact. But among all of them, I think the most prominent is photo damage. So sun does most amount of damage to skin, and it means that your skin can age much quicker than what it was aging at. So rate, it increases the rate drastically. So if you are extended exposure to sun, then maybe a 35-year-old person may look like a 45-year-old person. Now, darker people have more melanin, and more melanin means more protection against photo damage, because they are more capable of restricting UVA and UVB radiation. So you will typically see that people who are darker, the signs of aging appears later on their face. Typically Asians age much later than Europeans. So Europeans in your youth may have a very good skin, but they age much quicker. So amount of melanin, of course, has some say in that. If you look at photo-aged skin versus normal aging, then there are like couple of factors. One is extrinsic aging or photo damage can be 100% cured, whereas a older age related aging, you can only do so much, and after that, yeah, aging will have it, old age will have its own impact, so you can't completely recover from that. But from photo damage you can completely recover. Now Intrinsic versus extrinsic, if you see, in intrinsic aging, which means only old age related aging, your skin becomes drier, but in photo damage, it becomes drier and rougher at the same time. And in intrinsic aging, you first see only fine wrinkles, whereas here you see fine and coarse wrinkles both, because photo damage is accelerating the whole thing. And then if it's only old age related, then your pigmentation remains homogeneous, whereas in photo damage, even your pigmentation becomes uneven. So you will have darker patches and then lighter patches on the skin if it is because of photo damage. So that is everything to do with aging. Let's get to skin classification now. I'll just go back and check if there are any questions. Can everyone hear me? Okay, and no questions at all? Great. Okay, there is some comment I see. No, there is nothing. Okay, so I'll just continue with skin classification. If you really see, skin can be classified in many ways. You can classify skin based on color from light to dark. You can classify skin based on skin secretions. So dry skin, normal skin, oily skin, combination skin, based on the texture, whether it is smooth or coarse, thickness of the skin, so whether the skin is thick or medium or thin. But typically we look at color based classification and secretion based classification because they have an impact on what treatment can be used. And that is why it is important to see how that particular skin, what class that skin belongs to, and then you can decide either the dosage of the treatment or whether the treatment should be carried out at all in the first place. So for example, when you are using lasers, then for hair removal, ruby laser and alexandrite lasers were very popular choices for light skin. So these type 1 and type 2 skins, these are light skins. But when people tried using ruby and alexandrite on dark skin, so 5 and 6 for example, typically 4, 5, 6, they saw that it resulted in a lot of burns on the skin. And that is why ruby and alexandrite laser should never be used for permanent hair removal on dark. Can everybody go on mute, please? So they should never be used. So those are the most popular lasers for very fair and fair skin, but they are never used for olive brown or black skin. So that is how much impact skin color or skin secretion can have on what treatments you should do. So if you look at secretion based classification, you have normal skin, you have dry skin, you have oily skin, and you have combination skin. Now when you look at normal skin, you will see that there is very even texture, smooth. The pores are neither very big nor very small. It has very good blood circulation. So overall its appearance is very soft, very smooth and very velvety. It has no blemishes at all. It's not acne prone. So that is ideal. Normal skin is ideal. Now we look at dry skin. That's the next thing. Keep in mind, in India you will very rarely see dry skin. You will either see oily skin or combination skin. 70% people in India have oily skin, and if you go on internet you find tons and tons of stuff on dry skin, and that's because primarily Europeans and Americans have dry skin. Most of them have dry skin. So the lighter the skin is, the more chances are that it will be dry, and the darker the skin is, the more chances are that it will be oily. So a dry skin primary reason for skin to become dry is two reasons. One is if your stratum corneum is very thick, because that is where you only have 15% moisture, then it will become dry. Or the second reason is if somehow your transepidermal water loss is very high, if your barrier function is compromised and you are losing a lot of water from the skin, then you will have dry skin. So those are the reasons. Now if symptoms are not taken care of, then this dryness can increase. So initially you will have tight and rough feel to the skin, but then it becomes, after a while it becomes very dry if you don't take care of it, where it will become very tight, it will become scaly, chapped and itchy. You will also have itchiness. So when the winter increases, the extent of winter increases, sometimes you start having itchy skin, and that is why, because it has become very dry at that point of time. Okay, now causes of any type of skin, I would be very honest with you. Genetic, hormonal, those are the two most important reasons, and there is very little you can do to change your skin type. You have to live with it, you have to manage your skin type. Nobody can change their skin type. So most of the times it's because of genetic influences and hormonal influences. In certain cases, pollution, the kind of skincare products you are using, medication can make it worse. But primarily it is determined by genetic influences and hormonal influences. Age has some say in it, as I told you. With age, skin becomes drier and drier. So if it is oily, it will become less and less oily. If it is dry, then it will become more and more dry. Dry skins typically also ages quicker. That is also why white people age quicker than Asian people. So oily skin always ages less fast. What can you do to take care of the dry skin? Of course, a lot of moisturizer. When you are cleaning, you have to ensure that you're not using any harsh cleaning which absorbs more water from the skin. Keep it moisturized, but don't use too much of moisturizer also, because it may result into a breakout, because it may make your skin oily and you will have a breakout. Uh, and then avoid very dry air, being in very dry air. Now with Europeans that's a problem, because they have a dry skin and then it's very cold outside, so they have heaters on all day inside the house, and that makes the air very dry, and it has a even adverse impact. Don't spend too much time in hot water. uh, Use products without alcohol, without perfume, without artificial colorants and all of that. And then fluid intake should be more. That's for the dry skin. Oily skin, this is what you will mostly see in Indians. 70% people have this. Now one good thing is it ages less, but it has all sorts of breakout problems. So acne, you will have a lot of acne problems and all other skin problems also, because your body is producing excess sebum and excess oiliness, and that is why you have more chances of acne breakouts and other sorts of breakouts. Your skin will have a very greasy feel to it. If you go in hot weather for a very short time, it will become very oily suddenly. It will be constantly sweaty, your pores will be bigger. So oily skin has enlarged pores, and the makeup that you apply will mostly slide off. Because of the oiliness, it won't stay, it will slide off. Now reasons, again, they are genetic and hormonal in nature mostly, but with people with oily skin should uh, always keep the skin as dry as possible. So one of the ways of doing that is use a blotting paper to uh, blot off without scratching the skin too much. Don't damage, because if you damage, then your glands become active, and then they will become produce even more sebum. And uh, that is exactly why you should also not wash the skin too many times, because if you are washing it too many times and taking the sebum off and uh, you know making the skin feel dry, then your sebaceous glands will become overactive, and then they will produce even more sebum, and that doesn't help. Products, you will have to use oil free products all the time. Sometimes topical retinoids help, cosmeceuticals helps, isotretinoin helps. All of those products are available in the market. uh, so this is how you can take care of oily skin. Sensitive skin, can either be dry or oily. Sensitive skin is the skin where barrier function has been compromised. So anything can hurt the skin very easily because your barrier function is not strong. And that is why sensitive skin is very prone to catch all sorts of diseases. And when you are treating people with sensitive skin, you will have to take extra precaution for any reactions, etc. Because the barrier function has been compromised in that case. You should use milder products. Mostly sensitive skin is dry, mostly, but that's not like in 100% cases. You can have sensitive oily skin, but that is why in India you will very rarely deal with sensitive skin. Sensitive skin is mostly dry. Now, genetic influence, hormonal influence is the main reason. The problem with sensitive skin is any exposure to sun can cause a lot of damage. So anything that can go wrong will go wrong with sensitive skin always. So you should always use very mild products with sensitive skin. Whenever you are dealing with people with sensitive skin, mild products will always help. uh, and handle with care always. Combination skin is a very peculiar kind of skin wherein the T zone, so in this zone the skin is oily and elsewhere it is either normal or dry. So you have like two types of combination skins. You have normal combination skin where this is oily. So in a combination skin, T zone is always oily. And if this is normal, then you call it normal combination skin. If this is dry, then you call it dry combination skin. Now, in India, mostly when you deal with combination skin, it will always be oily and dry. It will not be oily and normal. Now, the problem with this is, if you really want to deal with it effectively, you will have to use separate set of treatments in the T zone and in the dry area, because you are dealing with two different types of skins. So when you are doing a treatment, the kind of products you use should be different for oily. So the kind of peels you use, or what kind of MDA you should be doing, all of that should be different for oily skin, and for the dry part you should use separate set of products. Similarly, when these people are doing their morning skin routine or evening skin routine, you should ask them to use products for oily skin for this region and products for dry skin for this region. Now, it is also recommended that for combination skin, you should ask the patient to use a blotting paper very extensively, because you will have oiliness in this region. So you will have to take care of oiliness only in this region. So they can just blot the oiliness, excess oiliness, but you cannot do that for the rest of the skin because it is already dry. So two sets of products, two sets of treatments for these kind of people. The most dangerous part is, lot of times when you look at combination skin, you feel it is oily because the T zone is oily. So you should look at pore sizes and all of that to ensure that the entire skin is oily, because pores should be enlarged for the entire skin. Do not mistake a combination skin for an oily skin, because if you do that, then your treatments would go wrong and the dry part of the skin will become even drier. Can you guys hear me? Am I still there?
Yes, sir.
Guys, one of you, can you please unmute and tell me, or write in the chat box if I'm still there? You guys can hear me properly? Okay, great. Okay, so this is about secretion based classification of skin. There is another classification which is based on color, as I said. So from the very light to the very dark, and that classification was done by a gentleman called Fitzpatrick, of course. So it is called Fitzpatrick classification scale. and it has class 1 to class 6 classes in which he defines or divides the skin type of everybody. Now if you look at type 1 to type 6, it is based on the color of the skin, and it is also based on how the skin reacts to the sun, whether it burns or whether it tans. So based on these two functions, he defines what type of skin it is. So here is the entire scale, and this is another representation of that. So 1 is very fair, 2 is fair, 3 is medium, 4 is olive, 5 is brown black, and 6 is black, totally black. 1 to 6. Now be very careful that this is not just based on the color of the skin, it is both color of the skin and how the skin reacts to the sun. So if you look at skin type 1, it always burns and it never tans. Skin type 2 usually burns and tans with difficulty. Third is sometimes burns but gradually tans. 4 is rarely burns and tans with ease. 5 is very rarely burns and tans very easily, and 6 is it never burns. So whether the skin burns or tans, in India we always belong to 3 to 5. So a very fair looking person in India, you might actually feel that he is a 2 or a 1, is never a 2 or a 1, because his skin does not react that way to sun. Most of the times we tan. So even if a very fair person comes to you, and if that person is Indian origin, then he is mostly 3, 4 or 5. So doctors lot of times keep very fair people in 4, Indian people even in 4, because their skin never burns. So that is what you should be careful about. If you look at Fitzpatrick skin scale, this is a very nice slide which explains everything. So the lighter your skin is, the more sun protection you need. So sunscreen here has 30 plus SPF for 1, 2 and 3. Whereas for 4, 5 and 6 you need less sun protection because your skin has enough melanin to protect yourself. But sun protection needs to be applied. It's not that because I am dark I don't need sun protection. Everybody needs sun protection. It's a mandatory part. Fits 1 and 2 are most prone to skin cancer. 3, 4 mild, and 5 and 6 is like very highly unlikely. Again due to melanin, because 1 and 2 have very less EU melanin, and that is why they are more prone. Now we have looked at the classification of skin. Let's look at some of the treatment modalities. So when I look at treatment, my treatment typically has 3 steps. It has pre-treatment, treatment and post-treatment. These are the 3 steps. So pre-treatment is the processing of skin just before the treatment. So whether it is removing the makeup, cleaning it up with alcohol and all of that, that is a part of pre-treatment. And then there is also another pre-treatment which is more long term. So you asking your patient to do certain things. So in most of the aesthetic treatments, what you will ask your patients to do is any retinol based products they are taking 2 to 3 weeks before the treatment, they need to be stopped. They should not do any other aesthetic treatments within past 2 to 3 weeks. So it's not that you do MDA and then next day you come for peeling. No, that's not how it should be done. So they should not be doing any other procedures, major procedures. They should not be on any blood thinners. If they are on any blood thinners, then they need to be stopped. Certain other type of medication also needs to be stopped 2 to 3 weeks before the treatment. If they are smokers, then it is advisable that they stop smoking 2 to 3 weeks before the treatment. So all of those things become a part of pre-treatment. In the treatment, most important part is that you have a written standard procedure and you are always following that. Most of the problems in these kind of treatment happen because you don't follow the standard procedure. That is where all of it goes wrong. So you should always ensure that people are following the procedures properly, your staff is following the procedures properly, and you are also following. And post treatment, again, you ask them to do certain things for a certain period of time. Sun protection is one thing you will always ask them to do, because what you have done is you have damaged either the epidermis or dermis, and you have compromised on the barrier function. So sunlight can do a lot more damage. So sun protection becomes even more important. Other treatments they should not be doing for a certain period of time, depends on what you are doing. Then some of these retinols and all of these products should not be started for next 2 to 3 weeks. So all of those post treatment advice should also be given very properly to the patients, so that they know exactly what to do. Now, treatments can be either a skin condition like acne or hyperpigmentation. So typically under aesthetics, the skin conditions we deal with will include acne, it will include hyperpigmentation, it will include either acne scars or any other scars. So for example, somebody had chicken pox and those scars remain, all other scars or some wound related scars which remain, warts and moles removal, all of these skin conditions can be treated under aesthetics. Skin aging, we will have to manage skin aging, and aging primarily you talk about eyes. Eyes have to be dealt separately because they're very sensitive, and the kind of products you can use for eyes are very limited and very special. Neck and face. Neck and under eye region is where the first signs of aging always appear. So neck and face both also come under skin aging, and then there are some special treatments. So they're not really like something happening, but permanent hair removal. So people don't want to wax again and again. Instead of that, they want permanent hair removal or tattoo removal. Those are some of the special treatments which we can do under aesthetics. So these are the treatments that we will do. Now what we do to perform these treatments, one is we can augment the natural components of the body. So introducing hyaluronic acid, for example, or glutamine. These are all present in our body, but with aging we lose some of it and we cannot remake it, and that is when some of the products or treatments would help us to augment these natural components. The second way these treatments work, and this is basically products, most of the products are doing this. So when you are using topical or oral products, then they are augmenting the natural components. The second way is growth stimulation, which is you stimulate, say, the production of collagen or production of elastin or production of melanin in the skin somehow, and then it will ensure that you have more of this in your body, and hence your skin looks more healthy. Some of the low level lasers perform this. This is stimulation. Prp Mesotherapy is doing stimulation. Prp is injecting a lot of growth factors into your skin and into your hair, which will help more production of these components, hence making your skin or hair look more healthy. Then you do controlled damage. You partially damage so that skin's repair function kicks in. But it's a controlled damage. You're not destroying the whole thing. So destroying a hair, destroying a part of your epidermis, that will ensure that repair function kicks in, and when it gets repaired, it is better than what it was. Most of our MDA, chemical peels, lasers, all of them work on the principle of controlled damage. And then the last is complete damage. So when you are using ablative laser to scrap off entire stratum cornea or entire epidermis, or you are targeting hair follicle and you are destroying the hair follicle so that you have permanent hair removal, those procedures are complete damage. So those are the ways you can go about doing treatments, and depending on what you want to achieve, you will pick which is the best one. In most of the cases, it has to be a combination of all of them. These are some of the machine based treatments which are available. So you can either do products for preventive measures, sunscreen and all of them. You can have topical and oral medication which will do augmentation of natural components. Then you can have non-invasive procedures. You will have some basic machine based procedures. You will have microdermabrasion in this, You'll have chemical peels in this, you have radio frequency, you have laser treatments, you have micro needling, which is derma roller and derma pen based treatments. You will have injectables like Botox and fillers and PRP and mesotherapy in this. And then you have invasive procedures. So invasive procedures are all these surgical procedures which are more or less out of our scope here. Now let's look at some of the individual machines or procedures and how do they work. We'll talk about MDA. We'll start with microdermabrasion. It is one of the safest procedures. The best part of this is it is one of the safest procedures. This mechanically scrapes off parts of your epidermis. So it can either remove entire stratum corneum or it can remove entire epidermis. And this is mechanical exfoliation. So there is either vacuum based or a diamond tip based where you are rubbing it on the skin and scraping off a portion of it. That is how it works. It's one of the safest procedures. Any skin type, fits 1 to fit 6, it is very safe. You can perform it. It takes some time, but it is very good result in the long run. Third most popular procedure in aesthetics. So the machines there is some initial investment, but this machine is not very costly, and these are very affordable treatments for your patients. No downtime at all. So your patient can just walk in, do MDA, and go to his office, and nobody would know. Just some redness. That's it. Chemical peels, these are like special solutions that you apply on the face, and then either some of them need to be neutralized after some time, some of them are auto neutralized, so you just apply them and that's it. Now these come in different varieties. They start from being very superficial peels, medium depth peels, and deep peels, and this definition is based on how deep they are going in your body. Very superficial peels only going up to stratum corneum. Superficial peels within dermis, epidermis, and then medium depth and deep peels are going all the way in dermis. So medium depth peels in the upper portion of your dermis, and deep peels are going all the way up to the lower portion of your dermis. These are extremely effective and very versatile. Peels can be used for almost any kind of procedures. So peels are effective for sun damage, peels are effective for aging, peels are effective for acne, peels are effective for scars, peels are effective everywhere. The best part of it is there is no investment. It's just a bottle, so it's all consumable that you are using. So there is no investment needed for doctors. These are also very affordable and limited side effects, but depending on skin type, you may or may not want to use certain peels. So if you have darker skin, so Indian patients, most of them, you would use lesser concentration of peels. You won't go for very high concentration peels, and you will give more time between the two treatments. So if a white patient can do peels at a frequency of 3 weeks, then for an Indian patient you should have at least a 4 to 6 week duration between two procedures. But overall, extremely good result, very versatile and very cost effective. Micro needling, in past few years I have seen it has gained extreme amount of popularity. It's a very simple thing. So you either have this kind of a derma roller or a derma pen. This derma roller, this has needles, you manually move it on the face, so they have micro punctures on the skin, and then either you apply some topical cream which penetrates better in, or you just do that damage and it's like then the skin repairs itself. So either ways it works. You can either have this manual way of doing it, which is micro so derma roller, or this is automated, which is a derma pen. Now these are very rarely used separately. They are not standalone treatments. They are used along with other treatments. So you can club, for example, laser and micro needling. This combination works very well. Or they can also be a delivery mechanism for PRP or for mesotherapy. So usual delivery mechanism for PRP and mesotherapy is syringes, injection based, but they can also be delivered through derma rollers. So that's derma rollers, again no cost at all, because it's a consumable. You buy it for 400 rupees and throw it away. Very low cost, no downtime at all for your patients. Now we come to laser and IPL. This is where the big game is played. Very versatile. They can treat a lot of different conditions. Extremely good results. So the kind of results you can give with laser and IPL are unparalleled. No other treatment can match the results, but there is initial investment in this. You have to buy lasers. Lasers are costly pieces of equipment. And the other thing is you have to be more careful. There are a lot of settings and all of that. With other procedures, there are not many settings. You just do the procedure. There is a standard procedure you follow. With lasers, there are a lot of settings. If the settings go wrong, it can burn the skin. So you have to be more careful. And then with skin types, so whether the skin is oily, dry, or combination, your choice of lasers will change. Similarly, whether it is FITS 1, 2, 3, 4 or 5, 6, your choice of laser will change. So FITS 1, 2, 3 typically are one group, and FITS 4, 5, 6 are one group. So the set of lasers you can use on 1, 2, 3, you cannot necessarily use them on 4, 5, 6. Now remember that light colored skins are, you can do any treatment mostly on them. But when you come to dark skin, so Indian skin types, you have to be more careful, because you can't use all types of lasers. As I said, ruby, alexandrite are a big no-no for Indian skin types. So you have to use Nd:YAG. Nd:YAG 1064 nanometer is safest bet for Indian skin. When you talk about other lasers, you might be heading for trouble. So that's lasers for you. Then you have RF and Mnrf procedures. Very similar to the way laser works, but laser works at a visible range, ultraviolet range and infrared range, and radio frequency devices work in a different frequency range, radio frequency range. Their best feature is skin tightening. So the moment I say skin tightening, I'm talking about RF. You have to use RF, and that is why these procedures are always clubbed. So if you do laser, after that you will do RF. If you are doing weight loss, then after fat reduction your skin becomes loose. So after a reduction of a session of fat loss, you will always do RF to do skin tightening. So but they can also do other things. And then there is this micro needling RF device which is available now. So mostly you apply them like this here in this picture, from on top of the skin. But with micro needle RF, these micro needles actually puncture inside the skin, and the treatment actually happens here at the tip. So you can actually penetrate this into these, depending on the depth of these needles, you can either reach epidermis or dermis. So you can decide what part you want to treat with Mnrf. So that's radio frequency devices for you. And then we talk about PRP and mesotherapy. PRP and mesotherapy are relatively new entrants in aesthetics. They have been used in other disciplines of medicine, but in here they are new entrants. PRP is where you take the blood, patient's blood, then you rotate it at a very high speed in a centrifuge, and then you take the plasma part. You discard everything else and take the plasma part. So if you take something like 35 ml of blood, you will typically get 3 to 4 ml of plasma from it. But it is platelet rich, which means in normal blood, whatever platelet concentration you have, in platelet rich plasma you have at least 3 to 5 times more concentration of platelets. And when you reinsert this platelet rich plasma back into a particular portion, say scalp for hair growth, or into the skin for into face for skin rejuvenation, it has growth factors which will help to stimulate. So this is stimulation based procedure. Again, it has absolutely no downtime. And in mesotherapy, it is also syringe based. You don't take blood. It's just external growth factors that you are directly injecting. So there is no procedure of taking blood and centrifuging it and then taking the plasma and all of that. You just get mesotherapy solution and you just inject that. So both of them eventually are introducing growth factors which are helping skin rejuvenate. That is what they are doing. And if you look at all of them at the end of it, it is the combination therapy that works. No one procedure is enough. You always have to use a combination of these procedures to give best results to your patients. So combination therapy is the flavor of the year. I would say it is the flavor of the decade. So every patient these days expects a particular customized solution built. And with most of the patients, you will always start some topical and oral products. Always. And they should be continued in the long run. And with that, you will use combination of different treatments that we talked about. So typically very popular treatments, MDA and peels together for rejuvenation. It's a very, very popular combination these days. And people earlier used to say that you either do MDA or peels. These days they first do MDA. So you take out stratum corneum, and then when you do peeling, its absorption in the skin is much more even and it is much deeper. So the effect of the peeling because of doing MDA before peeling is much, much better. Similarly, laser and plus peels combination is also very good for anti-aging. Laser plus RF for fat reduction is also very good, and topical always goes with that. You will have to develop your own procedures. There are a lot of doctors who have these proprietary combinations, and if you can do that, you will become extremely popular. And with that, we come to the last portion of this course, which is about the courses that we conduct. Now, the course that we conduct is called Postgraduate Diploma in Clinical Cosmetology. And as a part of this course, we are covering all of this. So whatever I talked about so far, we'll be going in depth and covering all of that. So we have 3 modules there. We have cosmetology, we have advanced aesthetics and lasers, and we have trichology. In cosmetology, we cover start from the very basic skin and structure and all of that we looked at in much more depth, and then we cover basic treatments, non-laser based treatments primarily, so peels, MDA and all of that. Then in aesthetics, advanced aesthetics and lasers, we cover lasers, and we cover lasers, RF, Prp and mesotherapy, and then in trichology we do hair, all the hair related treatments. Now we do this in online plus offline format, which means all the theoretical sessions happen online. So you don't really have to come here for doing the sessions. If you are not in Pune, then it is more convenient for you to do it online. And then for the hands-on part, we have one batch running every month, so you can come over here and do the hands-on as per your convenience. What we also do is these courses are always unlimited, which means you can attend these sessions as many times as you want. So if you complete the whole course and if you want to do it again, you just have to tell us and you can do it as many times as you want. Now, what are some of the things that we are committing? We are committing that we'll have very good, very experienced faculties. So we are not just covering the theoretical portion, but we are also covering all the practical aspects. So people who are practicing this will be able to actually tell you what practical problems or challenges you face. So those are some of the things we will also cover. It's a very detailed, in-depth coverage, which means it's not just superficial, this is how you do the procedure kind of a course. We start from the very basic theoretical part and then we drill down into all the procedures and treatments. Unlimited learning, I already explained you that. And then we keep doing one session every month where we give some extra knowledge to our old students. So it's not that, and that session is always free. So it's not that after your course gets over, the association ends. And this PGDCC is the base. Once you do this, then on top of this, you can do some specialization courses which are also available. We keep adding more courses to this list as and when new courses are announced. So scientific weight management can be a very good addition, which is machine-based weight loss. Clinical diet is a very good addition to this. Microbleeding and micropigmentation, which is permanent makeup, so permanent eyebrows, permanent lips, and all of that, scalp micropigmentation. You can do that course, and then we have Botox and fillers, of course, around that specifically. And for that, we do it with Allergan, which owns Botox. So Allergan is a brand that owns Botox, so we do it with them. So their certified faculty comes and they teach this course for us. So that's more or less what I wanted to cover. Now let me come back and see if any of you have any questions. Any questions at all? I know I have overstepped by 7 minutes, but I think we still could fairly manage, pack all of this stuff in 2 hours. So any questions at all? I will give you 2 minutes to think about it. Otherwise, we'll close the session. Any questions?